Quick question. Do people come to you for answers at work? Maybe you're managing projects, training new hires, or just the one everyone relies on. That's leadership. Through UVA Darden's part-time MBA in Roslyn, we help professionals like you turn real-world experience into recognized leadership credentials without stepping away from your career. Whether you work in healthcare, education, government, or business, this is how you take the next step. Learn more at darden.virginia.edu/PTMBA.
When it comes to what your family eats and drinks, you know your choices matter. You're the expert because you know what fits your life. And getting it right starts with good information. That's why America's beverage companies are sharing more information about our ingredients at goodtoknowfacts.org. No spin, no judgments, just the facts straight from the experts for more than 140 beverage ingredients. Visit goodtoknowfacts.org.
Optimization seems to be the newest buzzword. People are no longer willing to settle for good enough. We want to know the best ways to optimize every aspect of our lives. For our health, the common diet and exercise tips will get us at least halfway to our healthiest selves, a little more for those who maintain a consistent regimen. But Dr. Puya Yazdi says even the full benefits of diet and exercise can't be unlocked without knowing the most foundational part of who you are, your genetics.
If you're trying to maximize your health and you're not taking into account your genetic data, you're probably going to get maybe 50, 60, 70% tops on the way there. And it's a little bit of a range over there. But the reason for that is it turns out like genetics is an important part of what makes you. That's the reason you kind of look alike like your relatives. It's the reason why some people do well on some drug and some people don't do well on other drugs, why some people work well on some kinds of food and other people don't work on some kinds of food.
Yazdi is the Chief Science and Medical Officer at SelfDecode, a personalized health platform. It offers various genetic testing for users to tailor their lifestyle based on their genes. Yazdi says it's important to know this information because there are health factors that even the best diet and exercise program can't fix.
The example I always give people is, it turns out that some people, regardless of how well they eat, how much they exercise, are at risk for cardiovascular disease. They're at risk for getting heart attacks, strokes, and things like that. And that's purely from their genetics.
So someone could be doing everything right and have no idea their effort isn't lowering their risk. Our genetics can make us vulnerable to various health conditions that we could have no idea about until either getting tested or falling ill.
From a pure wellness perspective, which is not necessarily a medical perspective, genetics also does a lot of stuff when it comes to what kind of diet you should theoretically do, what kind of supplements you can take. There's data out there that, some people, for instance, here's as an example, you always hear this debate whether eating high salty diets is bad for you when it comes to hypertension, to high blood pressure. Well, it turns out it's actually genetic driven. That's why there's been debate for the last 23 years, because they do one study and they find it, do another study and not find it. And it just turns out that certain people, because of their genetics, are more predisposed to, get salt-induced hypertension. Once again, this is not something you can test for without doing your genetic data.
But while everyone could benefit from genetic testing, most of the time it's not covered by insurance, which means that right now, being able to fully understand your own personal makeup is a luxury reserved for those who can afford it. SelfDecode offers various reports, but their one test that does a full genome sequence can cost between $1,000 and $3,000. For many Americans struggling with the rising costs of everyday life, this may not fit into the budget. However, Yazdi says that for those who can afford it, it's a worthy investment to figure out how your genetics are influencing your life.
I feel pretty confident that if you ask most leading physicians at leading academic centers, experts, most of them admit this thing is very important. Everyone should get it done. I think everybody in America, in the world, should get a PGX test or a genetic test, find out what drugs are on. It's literally some of the most common medications. Just had, a couple friends I've been told about this, and, lo and behold, they, oh, whoa, yeah, it turns out my genetic testing told me I don't do well with statins. I knew it. I could never take statins. I was getting muscle aches all the time, right? So now their doctor can prescribe a better medication for them.
And this information can give you much more insights than how your body reacts to different drugs. SelfDecode focuses on a person's whole lifestyle, not just purely pharmaceutical interventions.
The ideal, what we want to do for a lot of people is you come in, you get your testing done, and you find out what kind of lifestyle adjustments you should be doing, what kind of supplements you can take, what kind of diet you can take, exercise, what foods to eat, right? A lot of times what customers want is something different than you're getting from your doctor. they don't just want to know you're healthy, you're good to go, you're not dying, get out the door. A lot of times they're trying to optimize their health, right? And a lot of times this is around about like what supplements I can take, what vitamins I can take, should I do yoga and stuff like that. And so we have a lot of that holistic approach of where we're trying to make this both a wellness product and a medical product.
The reports are structured so that someone can both share it with their doctor and be able to understand and implement it on their own. In a previous segment, we've talked about how your genes can predict many of your life outcomes. However, the field is limited to our current knowledge, and since many early studies were mostly done on European men, researchers are still working to close the information gap in other populations.
When it comes to genetics, one of the big problems is a lot of times this was a problem why people think we shouldn't have done genetics until recently. A lot of times the accuracy of your calls decreased when you went outside of a European population. And that's because almost all the studies, huge studies early on were done in European populations of Caucasians, both men and women, but And so we've developed a lot of technology to make this more transferable. So our risk scores have been validated against other populations. Now, it turns out there's still a problem, which is sometimes recommendations are based on like large studies that were conducted in European populations, which are not as well known in other populations. So part of our process here is to spend a fair bit of time doing the research to try to make sure we're giving the most accurate recommendations out there.
Yazdi says AI has been invaluable to this mission by finding the existing gaps. SelfDecode has also been able to use their customers' data to improve the accuracy of their reports.
Part of the process is we actually created an ancestry model, for instance. That's a very good ancestry model. Now, we don't make a lot of money ancestry, but the reason we did it is because this allowed us in order to make better predictions for non-European populations. It's gotten very, very good. The last iteration we had was like about 5% difference, which is not a lot, right? We're expecting this to keep going down and down through each iteration. We're hoping next year it's even less than 5%, and at some point it'll be perfect close.
But just because SelfDecode is doing it, that doesn't mean every other company is too. Which is why it's important to ask these questions before you buy a test kit. And though there are many different options to choose from when deciding what information you want to learn, Yazdi believes the real game changer is getting a whole genome sequencing report.
Now we're, sequencing your entire genome, every single base pair you have, and then using AI to figure out not just, if you're at risk for certain things, what diet and exercise, but really going in through the small, like little variant, like maybe you have a gene that's knocked out and only a handful of people have this on the planet or something like that. But what does this gene do? In theory, then what can this possibly do when it comes to your health? And so this would not be possible without AI. It would have taken a team of us to analyze this thing, make a report out of it, and send it out there and be charging the patient $10,000.
But AI has made the process much faster and cheaper.
And I think this is really going to be a game changer, especially because part of our product offering is we're going to hook it up so that, it also knows all your other health data, what your lab tests are, you can give it all that information. It has your genetic, then you can ask it questions, right? It's like when you go to OpenAI and ask health questions, right? Or Cloud when you ask health questions. The idea is now it's going to have access to all your data with all your risks and everything else in a manner which the AI doesn't hallucinate on things, can actually answer your questions. And I think this is going to be a real game changer.
The idea is for users to build their own personal health chart that continually updates throughout their life. And as SelfDecode gets access to new tests and information, they can plug it directly into your data to see more aspects of your health than ever before.
It's going to be a lifelong product that's going to keep getting better and better as the AIs get better, as our knowledge of genetics gets better, as our databases get better, and so on. But I do think we're finally at the point where I think this is a product you can start using today to optimize your health. And, 2 years, 3 years from now, you'll wonder how you actually did anything health related before this came out.
You can find more information about Dr. Puya Yazdi and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
This Father's Day, when you ship UPS Air at the UPS Store, your items arrive on time or your money back, guaranteed at no extra cost. It's like the father of all shipping services. It shows up to the airport way too early, just to play it safe. It's overprotective about all the things that truly matter. And it's always prompt, especially to be with family. Make it your first choice to celebrate your dad. Ship UPS Air with our money-back guarantee, exclusively at the UPS Store U.S. retail locations. Visit the upsstore.com/airshipping for full details. Terms and conditions apply.
Wow, you're still drinking soda?
Yeah, it's Zevia Creamy Root Beer.
Isn't soda full of sugar and bad?
Nah, Zevia doesn't have sugar or fake like other sodas.
Okay, but does it taste like?
Here, try one.
Oh, this is delicious.
Told you, Zevia. It's soda made better. No Find Zevia Creamy Root Beer, Orange Creamsicle, and more flavors at your local grocery store.